Oh, hello. Come on in. You know, here in the Professor's Lounge, we've historically prided ourselves on coming up with exams that are extremely difficult and cover unusual topics and take a long time to answer. But I think we've made a mistake this time around. One of your exams next week will be on script concordance. Let me show you how it works. Now this is what you're used to, multiple choice questions, but real medicine isn't like that, as you know. And again, one of our tests next week is going to use a different format called script concordance. Now with script concordance it's pretty easy. We give you a vignette or a brief clinical story. We give you a hypothesis to think about, a possible diagnosis, and then we give you some new information. And what you have to do is decide if that piece of new information makes your diagnosis more likely or less likely. For example, you're told you have a 61-year-old male coming to the emergency room with shortness of breath. You're told that you're thinking about pulmonary embolism, and then you're shown an EKG that has sinus tachycardia. What do you think? Well, certainly sinus tachycardia can be seen with pulmonary embolism, so it might make your suspicion for that diagnosis even more likely. But now moving on, let's say it's the same patient, but you're told that you're concerned about pneumothorax. On exam you hear bilateral wheezing, and you know that that might go along with asthma or heart failure, but that does not support a diagnosis of pneumothorax. So pneumothorax now becomes less likely, and you can move on to thinking about other things. So as you can see, these questions will be probably a lot more like seeing a patient in real time. Much better than multiple choice. And studies have shown that they're usually considered easier and can be answered a whole lot quicker than multiple choice questions too. We'll try to make it harder next time. We hope you'll like it. And if you don't, keep in mind that it's a very, very tiny part of your grade, and it's graded on a curve anyway, so do study, but enjoy your weekend.